Hey guys, Dr. Ben here. Excited to talk to you today about your questions, about your life, what you have going on. I'm going to be using the whiteboard today as well. It's my favorite way to teach, to talk about things, to educate, drawing it out, showing you what's going on. So welcome everybody. Just so excited to talk to you guys every week like this because there's so many questions. So many people out there are dealing with issues. They don't know what to do. They don't know where to go. And I want to give you some answers. I want to bring in, we brought in Dr. Jake Walden last week, a functional neurologist, amazing brain in the field of functional neurology. Love having that on. We're going to be bringing in some great minds on these Q&As as well to give you guys the best possible information out there to be healthy and vibrant and just live that life that you were meant to live. So again, welcome. Pop down below where you guys are watching from, but then also any questions at all. There's a little button up in the corner. It looks like a little bell. If you hit that, you will get reminded when we go live. And so that's a great way to keep in touch. I try to do it at a consistent time every week, but sometimes life happens. So it's a nice way to let you know other times. So as you go and ask these questions today, I want you to be thinking about the why. Don't just ask me how much vitamin D I need to take, what supplement should I take for this, but ask, why is this happening? Hey, Melissa in Iowa, great to see you. Why is this happening? Why are these things going on? Just like, I'll jump in, I've had some autoimmune patients this week, and it doesn't matter what autoimmune condition is in the middle there. Oh, and I love when I do this type of a whiteboard, I have to flip-flop the screen, and so when I raise this hand, it looks like when I'm looking at myself, I'm raising that hand and everything. So it's always fun doing these. If you haven't done a Facebook Live, you have to, and you're writing, you have to actually flip it, mirror the screen. So autoimmune, you've got to get to the why. Why is that happening? Well, it can be adrenals. It can be blood sugar. It can be vitamin D. You should be up at 80. It can be estrogenic events. That's why a lot of times women, after having a baby, they're never quite right. It can be leaky gut. It can be food allergies like gluten and dairy and some things like that. It can be infections, chronic infections like Epstein-Barr, all these different things. So that's what I want you thinking about. That's what I want you asking questions about is how can I get this better? Why is this happening? Those type of things. So let me jump back here. I think there was a question. Melissa, I have a question about mold toxicity. 6 months ago, it was 3. 1 year ago, I cannot see, for some reason, whenever somebody sends a long message like that. Oh, actually, I can't see it. I'm currently taking a binder, GI detox. Any other advice about what I can do in addition to eliminating mold exposure to help decrease the lab marker? Any certain diet that will help? Yeah, Melissa, mold is crazy. We had a moldy house a bunch of years ago, almost killed my wife. Very intense. My youngest, for the first year and a half of his life, he was born in that house, and he grew up there, and he would hit his head anytime he got frustrated. We moved out, and it was a miracle. Quit doing it. All those things. It can have a very major neurologic issue in there. So mold is complex. First thing you have to do with mold is fix the environment. And that is the biggest thing. So if you still have mold in your house, if you still have mold at your workplace, anything else, it doesn't matter what you're doing outside, how much binding, how much all of these other things, you've got to fix the environment first. And you've got to look, even in Colorado here, where we're very dry, we see people with moldy houses all the time. So here's what we look at is, do you have a crawl space? Is there moisture? What's your humidity level? If you have a basement, your humidity needs to be under 45% at the most, but I like it under 40%. You've got to check the showers. You've got to check any place that has had water damage, leaks, anything like that. You need to have a constant fan going in the bathrooms. All the bathrooms should have that fan going. A lot of times if you have kids, they'll take long showers and it gets hot and you get very humid in there. You need to look for leaks. A lot of people, they'll see mold come through drywall and they'll spray it down with some type of bleach or something like that, and then it comes back and they're like, well, that's weird. Well, guess what? It's on the other side of that drywall, and so it really, in that case, it probably is an active leak, so you need to cut it out. You need to figure out where the leak is. Fixing mold doesn't have to be $100,000, but you've got to eliminate, just like if you have infected tissue and you've got to get rid of that infected tissue, same thing in the house. You've got to go up 6 inches higher than any previous water damage. If you look at your baseboard and you see a ring around the drywall, you've got to cut up 6 inches higher than that. You've got to go into that shower, cut out those pieces that have been damaged, the wood, the drywall, the floor, anything that's damaged in there that has that mold potential, you've got to get rid of. But first you've got to make sure that there's no active leak. So then from there, then you can go with binding, which is what you're doing, and that's going to be great. That's going to grab a hold of that mold, help pull it out. But ultimately, you've got to look at all of the other systems in your body, because that's going to be the biggest thing that's being affected. Is your thyroid can get thrown off. I've seen people get Hashimoto's afterwards, other autoimmune conditions, all types of different things are going to get thrown at you. And so you've got to fix all of these other systems. Otherwise, the mold may be this little thing, but your systems, your body has gone haywire and is creating all of these different issues. So you've got to deal with the environment. Our favorite products are CitraSafe, and then they also have a air test that you can do. It's like a petri dish, and so you need to test your rooms. You need to test those before and after doing cleaning. You can get air filters. I like the Austin Air is our favorite. That's what we have in our home and in our office. So it's a multifaceted approach when dealing with mold, but it is very prevalent out there. So hope that helps. There's no magic supplements, glutathione, resveratrol, some of those different ones are going to be helpful. There's nothing magic out there, but you've got to start somewhere. So great question there. Hey Paula, great to see you. And let's see what else we have for questions. All right, go ahead and pop those down below, guys. And severe vertigo, and this is Jenny, day 3. Did Epley maneuver, pop in brain before onset. So, and I'm assuming the Epley maneuver did not help. So here's probably what's going on. If the Epley maneuver is where you lean the head back and you tilt it around and get those crystals to settle back in the right place. So sometimes vertigo is because the crystals get out of balance, but there's other things that can contribute to that. So we're looking at potentially even a viral infection can contribute to your vertigo. We'll see that a lot of times, and people just had a patient that it was about a week and a half. Some people had been sick around her, and hers came out as this vertigo, and as she got better, that vertigo got better as well. So I wouldn't be surprised if there's some type of viral infection going on. Bump up your vitamin D a bunch, take all your viral support, crank up your zinc, do all of those things, and I think that is going to be helpful. All right, Paula, what is the cause of a really red roof of your mouth? I was told a mouth breather. Usually what we're looking for in the mouth, if you have a white coated tongue, that's going to be potentially some bad bacteria, microbiome, yeast imbalance in the digestive tract, a lot of those things. Red mouth on the top, if it's really red, it could be dry. It could be dry from the mouth breathing. Unfortunately, about the only way to fix that, one, you can practice throughout the day, just breathing through your nose, but there are actually there's this tape that people use over their mouth at nighttime, and it basically makes them breathe through their nose. If you breathe through your nose, you're going to stay more hydrated. You're going to lose less fluid, less likely to be dehydrated. and just actually stimulate the brain better if you're breathing through your nose. So whatever you can do to nose breathe is going to be better. If you've got serious congestion or deviated septum, those type of things, you've got to get that fixed. But nose breathing is very, very good to do. All right, so guys, go ahead and pop those questions down below. Love having you on. All types of information out there. It's crazy what we're getting inundated with. I just was looking at some information when we're talking about prediabetes and diabetes. 85% of the population, we are on track for 85% of the population to be pre-diabetic and diabetic. I mean, that's trillions of dollars a year. We've got to make these massive changes. Here's a question popped in. Alyssa, what to do about fungal infection on abdomen? Doctor says topical cream. How do I find underlying cause? I love that. So all of you guys watching, look at that underlying cause. So anytime there's a fungal infection, so that could be on the toes, that could be on the abdomen, that could be in the mouth, all over the place. Yes, topical probably is going to be necessary. You know, if you have toenail fungus, if you have abdominal fungus on the skin, yes, there's probably going to need to be some knockdown, some kill off to do that. But you also have to find that underlying cause. Most of the time, there is a gut issue when we're dealing with any yeast, fungus, things like that. The bad bacteria, the microbiome, the yeast can get out of balance. So you've got good stuff and you've got bad stuff. What happens is when you knock the good stuff down, antibiotics, if somebody was born C-section, if they didn't nurse, all these different things, their good bacteria is down and their bad bacteria is up. And so at that point, we actually have to kill off the bad stuff. And my favorite product, they've been on back order, unfortunately, off and on this year, just with the whole supply chain issue. Brittany, you can put in that ADP from FullScript, but the oil of oregano is going to be one of the best things that you can do to deal with yeast and fungus. We have one that's time release. It'll actually get down deep into that gut and kill off the bad stuff. Then you bring in the good stuff. But topically, you could do some tea tree oil. You could do oil of oregano if it's you want to put it in a little bit of oil. You want to dilute that a little bit, will be helpful in there as well. You want to decrease your sugar consumption dramatically. Sugar is going to feed that yeast. It's going to feed that fungal infection. You've got to decrease that dramatically. Get that glucose monitoring going as well. Make sure that your blood sugar is staying where it needs to be. And then ultimately probiotics. And you can actually do a probiotic paste. If you open up capsules of probiotics, mix it with a little bit of water, and then put it over that spot after you do some kill off, then you can actually bring back, because we've got flora all over. We've got good flora in our mouth, in our nasal passage, in our ears, on our hands, skin, all over the place. So it's okay to add some of that probiotic topically. If somebody's got a really bad white tongue, if they've got almost this thrush look to it, the probiotics, especially, there's ones that are soil-based. So you want to look for soil-based probiotics, and that's going to be the best to deal with that yeast fungal topically in there as well. So hope that helps. Alyssa, Angie, is there a specific reason for the little red dots, not rash, that appear over time? Not sure where you're talking about little red dots. Is that just over the whole body on the skin? Some of that is kind of aging spots. Let me see, Janet, with all of the supplements I take, I often wonder if there are some that I shouldn't be taking at the same time because of the interaction they might have. So some of the ones that you want to take separate from each other, if you're taking a probiotic, you want to make sure you're taking that separate from any type of a kill-off. So garlic, oregano, anything like that, you want to take that separate. As far as other things that would inhibit absorption, or some that would be better taken with meals, if you are doing some kill-off, if you're doing anything that could irritate that gut, zinc, iron, some of those, definitely better taken with food. If you're taking enzymes for inflammation or enzymes to get down sinus, any type of irritation that way, it's going to be better to take that in between meals as well on there. What could be the causes of high blood pressure in your 30s? So, Andrew, great to see you. High blood pressure in the 30s, one of a couple things. One of the most common reasons why we see high blood pressure. So if blood pressure is high, it almost always equals blood sugar is high. So you've got to look there first. If somebody gets their blood sugar stabilizes 9 times out of 10, their blood pressure is going to go down. So you've got to address that first, get your glucose monitoring going, get that as stabilized as possible, and that's going to be the first place to go. The other thing you would want to look for are if you're taking thyroid medication, are you taking too much? Is your thyroid too high? Are you having a Graves autoimmune flare-up to the thyroid? That can rev up the blood pressure. Anything else that may be overstimulating, sometimes just if somebody's in a chronic stressful situation and those adrenals and that cortisol is go, 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 that could be a big part of it as well. So start with the blood sugar, look at the thyroid, make sure, and even liver wouldn't be a bad idea because it's like 60% of the blood flow coming out of the heart goes through the liver, and if the liver is stagnant, having issues in there, fatty liver, things like that, it's going to slow down that blood flow and cause increased blood pressure as well. Thanks for jumping on. Thanks for asking that question. With cold and flu season here, could you remind me what dosages of vitamin D and vitamin C, etc.? So here's the deal. I can't tell you how much vitamin D you need unless you tell me what your vitamin D level is. So vitamin D, you want to be in that 60 to 80. So most of our patients, we want to see 60 to 80. If you've got autoimmune, you want to be closer to that 80 level. So depending on how much you have in your system, let's say somebody is at 25, we like at 60 to 80, they might need 10,000 a day to get up to where they need to. So you've got to know what your level is versus if somebody comes in at 45, they might only need 5,000 per day. So it just really depends on what that person's doing. But vitamin D is huge. We'll have some of our patients, we'll have them do 50,000 per day for 3 days when they come down with something. So if you feel a tickle, if you see everybody else around you getting sick, we'll crank people up even to 50,000 a day. Again, that's a high dose. Make sure you're monitoring it, doing all those things. I can't tell you that's what you need to do, but that's what we'll do with patients. Vitamin C is going to be at the level of 2,000 to 3,000, as long as vitamin C can cause gut irritation, can cause diarrhea, things like that. But 2,000 to 3,000 is a good therapeutic dose for vitamin C. Your zinc, again, it's hard to tell exactly how much you need, but a lot of people, if they're coming down sick, 100 milligrams, but anywhere 25 to 75 milligrams is usually a pretty standard dose for prevention, for just good zinc utilization there. So that's going to be, if you do get sick, you can bump that up as well. If you're getting nauseous with it, if you can taste it, it's probably too much. You can also do the zinc taste test where there's a liquid zinc, and you can try that and see if it tastes really, really bitter, metallic-y, everything, you've probably got enough zinc. If you can't taste anything at all, if it's like water, then you want to be more up at that 75 milligrams on there as well. So hope that helps, Diana. If you have any other questions on that, drop me a line. And hey, Frank, thanks for the stars there. Appreciate that. And all right, let's, I don't see any other questions right now. Let's jump into some other things. Yeah, there we go. To elaborate, very small red moles on belly back, they have appeared over the years. Yeah, Angie, I've never seen any, and they're talking about those little age spots, those little red dots on there, and you can probably almost pop them and they'll bleed a little bit. I haven't seen anything topically, any like, oh, they're liver spots or whatever and you need to detox. I have not seen anything specific over the years as to what would help and what we need to do to deal with those. So sorry on that one. You're welcome, Diana. All right. Okay. So a couple other things. Remember, if you are dealing with thyroid, you've got to check TPO and TG. These are the two autoimmune thyroid Hashimoto's markers. Those are going to tell us if we have an autoimmune condition going on, not just to the thyroid, which is what TPO is, but to thyroglobulin. Thyroglobulin is going to be our bus that transports around the body. So people come in all the time and they say, oh, I've got Hashimoto's, and I say, which type, which is important, and the vast majority of people do not know that. So if you are having a thyroid issue, you have to check for Hashimoto's, and if you have a Hashimoto's issue, you have to know whether it's the thyroid being attacked or the transportation, because if that tire is shot out, you are not going to be able to get, even if you have the highest level of thyroid hormone out there, you are not going to be able to get that in. So you've got to figure out which one of those it is. Any recommendations for resistant hypertension, blood sugar normal, no spikes, just seems to be resistant to just about everything. So with that, some people just have a hereditary thing, and I usually don't like to fall back onto, oh, it's genetic, but some people, like everybody in the family has high blood pressure, and so that's what we'll see. Blood sugar's normal, no spikes. Lorraine, what is your A1C and what is your fasting insulin, fasting glucose, some of those numbers? That's what I would want to see. I would also want to see what your adrenals are doing. The adrenals can cause an issue with blood pressure. They can affect those kidneys, and then just being in a chronic fight or flight state. So doing a brain map, figuring out what those brain waves are doing. If you've got any excess fight or flight going on in the body, that can definitely be a big part of it. So if you're kind of a stressed out, worried person, you've got to look into neurofeedback, get that brain calmed down, figure out what's going on with those adrenals, and then let me know what your A1C is doing. Melissa, I had an old question earlier. Secondly, I've had oral thrush 3 times in the last 2 years. Could these be related? Absolutely. So again, like we were talking about before, you've got to deal with your gut and that microbiome. Almost every person that comes in with mold issues has gut issues going on. So you've got to deal with that microbiome, kill off, build up. Is it important to have protein at every meal? Hey Kat, great to see you. For most people, some type of protein at that meal is going to be very helpful. Doesn't have to be a 12-ounce sirloin, but even 2, 3, 4 ounces, a little bit of sardines. Everybody loves sardines, right? Give me a thumbs up if anybody likes sardines out there. Even a little bit of sardines, a little bit of chicken, turkey, venison, buffalo, anything like that. It doesn't have to be a huge amount, but a little. There's some of my friends, my sardine friends out there. So a little bit of protein for what we found with patients to keep the blood sugar stabilized throughout the day. A little bit of protein in each meal is very, very important. It's going to keep it from spiking. It's going to keep it from dropping and be a nice stabilizer for that protein. So for most people, and that's why you got to check your blood sugar and see what it does with those meals. Lorraine, it's not me, it's a patient. So if it's a patient, I mean, unless they're checking their blood sugar all the time, I would still go back to, their blood sugar is probably spiking up at some point, and you may just, in blood work or whatever, you may just not see it. A1C 5.3, 94, insulin, cortisol normal, liver good, kidney function. I would have to dig through that blood work a little bit more, because I almost guarantee something is out of balance in there. And but again, if you're looking at it compared to the lab range versus our healthy optimal range, that would be the biggest thing to look at. Is probably some of those numbers are not going to be where they need to be. And my son has swollen lymph glands in his neck all the time. We had them tested, and they are not cancerous. He's only 20. Bring this up here. Hold on. Can't see the rest of your question. There we go. Blood tests are fine according to the doctor. I wouldn't be surprised if his white blood cell count is under 5. If the white blood cell count is under 5, it's usually a chronic infection for somebody that age. I wouldn't be surprised if there is Epstein-Barr, some type of chronic viral infection, just low grade, stressing on the body, having those lymph nodes swollen in there. It's not a full-blown infection, something that's really trashing the body right away, but it's probably a long-term thing. But unfortunately with those, they can turn into autoimmune and a bunch of other things. So you got to figure out, look for white blood cell count under 5 and look for lymphocytes over 38, and that's a very good indication there's a chronic viral infection going on. Candy, my daughter, gets flu-like symptoms every time she starts a period. What causes this, and what can she do to help? We will see this, and it's an inflammatory process that's taking place, and this is something that it's probably going to progress into fibroids or cysts or things like that if you don't get it taken care of. There's got to be some type of imbalance going on with the hormones. One of the first places it starts, just like PCOS and any other hormone thing that we look at, usually there's some type of insulin resistance or metabolic syndrome going on. I would look at DHEA. You want to make sure that's not at the higher level. The testosterone might be at the higher level. There could be some PCOS type symptoms going on, but definitely an inflammatory process. Just some simple things you could do with supplements would be to crank up magnesium before she starts her period, like the week before. Get some high dose magnesium, fish oil, turmeric, some of those things. Just see if you can calm that inflammation down before, but then you got to dig deeper and figure out what else is going on there. Great question though. Deanne, protein isn't the only meat. So it sounds like Deanne might be a vegetarian if you're or even not, but here's the deal. Protein is not the only meat, or protein isn't only meat, meat isn't the only protein, but guess what? Here's the problem is that people say, oh, beans are great protein. Well, beans have what, 6-8 grams of protein, and there are 40 grams of carbs, 30 grams of carbs in different beans. We see people all the time, they eat a couple beans with their meal and it spikes up their blood sugar to like 140, 150, things like that. So beans are not a great source of protein because the amount of protein to carb is a very high out of balance in there and can cause a lot more problems. Then they go, oh, quinoa is a good source of protein. Well, it's a grain, and almost every patient that we work with, their blood sugar spikes up through the roof with quinoa as well. So, quinoa is not great. Soy, we don't want to be eating soy burgers, tofu, all those things. For the vast majority of people, soy is not a good constructive source of protein. And then you've got the fake proteins out there, Bill Gates and all of his fake meat and all of those things, really not great. There is one that I'm looking at that should be coming to market pretty soon, and it's a fungi based, and it's grown in a lab and everything, but it actually looks like meat and everything, but it's not soy. It doesn't have any of these other problems that a lot of these other fake meats do. So unless you've got another, and even with almonds, nuts and seeds, things like that, really not going to be enough protein to cover it. And then you start getting calorie wise. If somebody's eating 25 grams of protein with almonds, their caloric intake is up through the roof as well. So what may cause my arms to bruise easily? Deb, check your ferritin, check your iron, check your red blood cells, hemoglobin, hematocrit, and if you live in the Mountain West, if you live at elevation, you want those to be at the upper end, but if they're at the lower end, that might even be a full-blown anemia. You also want to check your platelets. A lot of people nowadays are getting ITP, autoimmune to the platelets, and that can cause them to bruise easily, so you've got to figure out if you're anemic. Allison, I love Wild Planet sardines. There you go. Other than COVID, what can cause altered taste? How can you correct it? So usually zinc deficiency will cause a low sense of taste or smell. So I would get some zinc cranking up there and get that started. See if it makes a difference. Got a couple more questions, and I've got to run. What may cause my arms to bruise easily? Oh, we already got that one, Deb. And yes, eggs. Deanne, you're right. Eggs, I count eggs as meat, as protein. Some people think, oh, that's vegetarian or whatever, but eggs are in the same category for me. I eat eggs most every morning. Eggs, wild game, things like that. Those are all in the same category for me. Nuts, fair as far as proteins, but pretty darn high. Whey protein, depends on the person. Some people can have whey and dairy products, other people cannot. So there's a lot of different protein powders out there. Whey, there's bone broth, collagen. Dr. Axe, good friend of ours, does neurofeedback at our Tennessee office. He's got the bone broth protein, he's got collagen protein, Ancient Nutrition, great source there. Good friend of F8, and you can do pea protein. A lot of people get digestive issues with that. Definitely want to stay away from soy protein. So there are some protein powders that work. I use bone broth most every day in my drink. But when we're talking about with a meal, I mean, most people aren't putting protein powder on their salad or whatever. You're welcome, Debbie. And Michelle, great to talk to you yesterday. And awesome. Okay, I got to run. How successful have your clients been with reversing diabetes using one of your nutrition programs? Here's the deal. Love it. Last question, and then I'm out. Michelle, egg protein. Yeah, egg protein is going to be fine as long as you're okay with eggs. Here's the deal. People can reverse their diabetes in 6 to 8 weeks. It's amazing. When we get glucose monitoring going, figured out type 2 diabetes, people can reverse that in 6 to 8 weeks. Even type 1, insulin dependent, people are able to cut their insulin in half. Some patients, if they do what they need to do, eat the way they need to eat, certain meals, they don't even have to dose insulin. They don't have to shoot any insulin in their body because they keep it so steady. But literally, people can reverse their diabetes in 6 to 8 weeks. We see it that quickly. We don't give out blood sugar supplements. There's no magic bullet that we do. We figure out what foods make it go up, what foods make it go down. So you or a loved one can get your diabetes better. So anyways, love having you guys on. If you've got any questions at all, drop us more down below. Brittany will be watching these. We'll answer these questions throughout the day. And then if you need more help, we're here for you guys. Tennessee offices, we're opening up our second one. We'll be opening up in Denver, down in South Denver. We're just looking at the space today, actually. So say a little prayer. It's the right one for us, Highlands Ranch. And we will be opening there in January if all goes as planned. So we will have multiple locations. We can help people all over, people from Montana, Indiana, all over the place coming in. So love seeing you guys. Share this information. We've got to get this world healthier. All right, guys, make it a great day.